is a See Jason podcast, and I am Dr. Matthew James, nephrologist, with Ellen Novak, nurse practitioner, and Tayler Scory, biostatistician from the University of Calgary and Alberta Kidney Care South. We are privileged to have the opportunity to present our study titled Nurse Practitioner Care Compared to Primary Care or Nephrologist Care in Early CKD on behalf of our co-authors. Patients with CKD can be identified at early stages of disease by reduced estimated glomerular filtration rate or albuminuria. According to current evidence, interventions that prevent progression of CKD work best when initiated at higher eGFR, and primary care physicians frequently refer patients to nephrologists at early stages of CKD. There are more patients with early stages of CKD than can be cared for by nephrologists, so other models of providing evidence-based care for people with early CKD are needed.
I am Ellen Novak, a CKD nurse practitioner in Alberta Kidney Care South. Nurse practitioners like myself are registered nurses with advanced practice training, which allows us to practice autonomously. Adding nurse practitioner support to physician care has been shown to improve kidney outcomes in patients with moderate to severe CKD. However, it was unclear whether early-stage CKD care provided primarily by nurse practitioners can improve the quality of CKD care and outcomes. Therefore, the purpose of this study was to compare the processes of care and outcomes of patients with early-stage CKD cared for by nurse practitioners to those cared for by either primary care physicians alone or by nephrologists.
I am Tayler Scory, a biostatistician from University of Calgary. We created 2 matched cohorts of patients with CKD living in southern Alberta, Canada, using province-wide administrative healthcare data. The first cohort matched patients who received nurse practitioner care to patients who received primary care alone, while the second cohort matched patients who received nurse practitioner care to patients who received nephrologist care. Our study examined process of care outcomes, including whether patients received prescriptions for medications that improve kidney and cardiovascular outcomes in CKD, such as ACE inhibitors, angiotensin receptor blockers, and statins, and whether patients received the recommended measures of kidney function and protein in the urine. We also examined clinical outcomes over 5 years of follow-up, including all-cause mortality and rates of all-cause hospitalization. We found that patients receiving nurse practitioner care had greater use of these guideline-recommended medications and were prescribed NSAIDs, which are preferably avoided, less often, compared to patients receiving care from a primary care physician only. They also had more outpatient kidney function and urine protein monitoring, and lower rates of hospitalization and mortality. When compared to patients receiving nephrologist care, patients receiving nurse practitioner care were again more likely to be prescribed the guideline-recommended medications and had similar risk of experiencing adverse clinical outcomes.
Thanks, Ellen and Tayler. To conclude, our findings suggest that early-stage CKD care provided independently by nurse practitioners is associated with better guideline-concordant care than with primary care alone or with care by nephrologists, with clinical outcomes that are similar to those achieved with care by nephrologists. We believe that our findings show how care models that incorporate nurse practitioners can positively impact the quality and outcomes of early CKD care.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.